Hi everyone, I'm Dr. Amaal Starling. I am here on behalf of the American Migraine Foundation on the last day of June, which is Headache and Migraine Awareness Month, so MHAM. I'm so excited to be here today with a really fun topic, which is migraine comebacks. And I think that this is very important for people like me because it's really hard for me to come up with things at that exact moment as far as comebacks. And so honestly, I'm one of those people that have to plan comebacks for potentially incorrect, irrational, or insensitive things that people say. So thanks again for joining. I know we've got some people on. Like I said, I apologize for being a couple minutes late, but I had to switch over from my desktop to my phone for some technical difficulties. So again, migraine comebacks. So let's go ahead and get started. So first of all, with migraine, what's really important is that we provide education not only to ourselves and to the people around us, our loved ones, our friends, but also to the public. And that will help even reduce the need for having migraine comebacks when people say things that are insensitive with regards to migraine disease. And so understanding that migraine is a genetic neurologic disease that has environmental risk factors is really important, and honestly will be one of the main comebacks that you can come back with whenever there are questions or comments that are made because of the ignorance of that individual and just the little knowledge that they know about migraine. Unfortunately, migraine has not been talked about for many years, not just in the lay public, but also, unfortunately, in medical education. Very little is taught about migraine in medical school. Very little is taught about migraine even in a neurology residency. And we, as headache specialists, are definitely trying to change that as much as we can. So, migraine is not just a headache. Migraine is a genetic neurologic disease with environmental risk factors. The other thing that's really important to keep in mind about migraine disease is that it is not present one day and gone the next. And so what does that mean? So, when people say, oh, I had 3 migraines last week, but I don't have migraine today, that's actually an incorrect use of that language. It's important to look at ourselves who have migraine as well as educate others who don't have migraine that migraine is a genetic neurologic disease that is present every single day. However, there may be days where you're having a migraine attack, and there may be days that you're not having a migraine attack. My favorite analogy to use both with patients as well as caregivers about migraine is using the asthma analogy. We don't say that you have asthma today, but you don't have asthma tomorrow simply because someone's not having an asthma attack. Asthma is a lung disease, and in people who have asthma attacks, they have asthma every day and all day. They have the lung disease of asthma every day and all day. And depending on the severity of their disease, they may have a couple attacks a year, a couple attacks a month, even multiple attacks throughout the week, and have very severe disease. And so not only does it emphasize that migraine is a disease that's present every day, but it also emphasizes that there is a huge spectrum of disease. There are some people with migraine attacks a couple times a year, and there's other people with migraine symptoms on a daily continuous basis. And that's very similar to that asthma analogy. The other really important thing is the differentiation between cause and trigger. So the cause of migraine is genetic mutations or genetic abnormalities. So there are over 100 different genes that have been identified as having some sort of association with migraine vulnerability. And so the genetic basis of migraine is the cause of migraine. And then there are triggers, those environmental factors that can trigger a migraine attack. such as hormones, such as bright lights, such as loud sounds, such as different foods for different people, such as different odors, such as exercise for some people. But those are all triggers. Those are not the causes. And it's really important that we, as people with migraine, keep those two forms, those two words very separate. And it's very important that we do that for others around us as well. Now, as I mentioned, that migraine, the genetic basis of migraine has over 100 different genes that have been identified that have some sort of association or vulnerability with migraine. So that also emphasizes that my migraine disease is not the same as your migraine disease, and not the same as all 8 patients that I have in this afternoon. All of their migraine disease is a little bit different. And that's important to keep in mind for us as well as for caregivers, loved ones, and the public, because what is going to work for one person is likely not going to work for the other. And so that's why there are variations in the genetics that underpin an individual's migraine disease, which is why there's variations in treatment as well as variations in trigger for each individual person who has migraine. So it's a very individualized disease, and that's why treatment must be very individualized. It's also highly prevalent and highly disabling, and sometimes having those numbers can be very helpful for some of these comebacks. So with regards to prevalence, 1 in 5 women, 1 in 10 children, 1 in 16 men have the disease of migraine. Highly, highly prevalent. As far as being disabling, understanding and knowing and sharing the knowledge that the World Health Organization has listed migraine as one of the most disabling diseases worldwide. In fact, as far as neurologic disorders for individuals less than the age of 50, it is the most disabling disease. And so that is an important fact to know and to say, this is what the World Health Organization has said. Not what I'm saying, not what my doctor is saying, but the World Health Organization has listed this as one of the most disabling diseases worldwide. Now, some of the things that people will say will be centered around, why are you having so many migraines, right? So why do you have all these headaches? And these are where you will talk about difference between cause and triggers, and you'll talk about what migraine is. So someone with migraine might say, I'm having a migraine today. And then someone else says to you, why? What did you do? Did you eat something? Did you drink too much? I get a lot of headaches when I drink too much. And that, unfortunately, plays the blame game, right? What did you do that's causing your headaches? What I want you to do is reject that blame, reject that guilt. Migraine is not your fault. The DNA that you have is not your fault. The genetic mutations that you have are not your fault. Migraine is not your fault. Reject that guilt. If someone says to you, what did you do? You say, well, I did not do anything. I have the genetic neurologic disease of migraine, and I am having a migraine attack because I have this neurologic disease. Also, when someone says, I get a lot of headaches because of blah, 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 you let them know, I'm not having a headache. Thank you for sharing your experience, but I'm not having a headache. I'm having a migraine attack. And migraine attacks are not synonymous with the word headache. In fact, you can share that there are some people who have migraine disease that don't even have head pain. Migraine is abnormal function of the brain, and that abnormal function can result in abnormal processing of multiple sensations, pain being the most common, but the other ones include light, sound, smell, motion, etc. And so migraine does not equal headache. Migraine is not synonymous with the word headache. Migraine is not a headache. Migraine is abnormal brain function that results in abnormal processing of multiple sensations, one of which might be head pain. All right? So the next time someone says to you, what did you do wrong? What are you going to say? You say, I did not do anything. I am having a migraine attack because I have the genetic neurologic disease of migraine. Now, someone else might say, you're having a migraine again? Didn't you have 3 migraines last week? Why are you having a migraine again? So here, this is their ignorance. They don't know about migraine disease. And it's your opportunity to educate and reframe the disease of migraine by saying, well, actually, I have the neurologic disease of migraine every day. And yes, it is true. I had 3 migraine attacks last week. And yes, unfortunately, I'm having another migraine attack today. All right? So this is a good way of reframing the disease and providing education. Now, some people will say, well, you've been getting a lot of these headaches, you've been getting a lot of these migraine attacks. Have you had an MRI? I mean, maybe there's something wrong. Maybe you need an MRI. And that's your opportunity to educate. You let them know if you want. You can let them know if you've had one before or not. But the most important thing is educating them that I have migraine, which is a genetic neurologic disease which results in abnormal brain function. And so I don't have abnormal brain structure. So an MRI or a CT scan, it's not going to do anything. That only tells you about structure, tells you nothing about function. I have the clinical diagnosis of migraine, which is a genetic neurologic disease resulting in abnormal function of the brain. Now, a lot of this involves you telling individuals what migraine disease is. And this is important when individuals will say things like, why do you have a headache? And you want to correct them and say you're not having headaches, but you're having migraine, which is a disease, a neurologic genetic disease. Other times people will say, well, you don't really look sick. How can you really be that sick, right? And this is a tough one, right? And it really hurts because migraine is such an invisible disease. And this is where it's your opportunity to make this invisible disease of migraine visible by sharing your story, by speaking out, by explaining that migraine is a disease that is abnormal brain function. And that's why people can't see it. But these are all the symptoms that you are experiencing. Now, a lot of people will say things like, well, I have migraine and I come to work every day. So why are you missing days of work because you have migraine? An opportunity for you to explain about the spectrum of disease. And this is where you can use the asthma analogy. Yeah, there are people that have asthma that use a rescue inhaler a couple times a year or a couple times in their life, right? However, there are people who have asthma who get hospitalized on a weekly or monthly basis because of how severe their asthma disease is. That is the spectrum of disease severity, and that is very similar to migraine, where there are individuals who may have had 1 or 2 migraine attacks in their entire life, but there are other people who have migraine symptoms on a daily basis, and that is the spectrum of disease that is present in migraine, and it's present in many other diseases. It's just a reframing of the way that people think about migraine, and we can take these opportunities to do that. So if someone says to you, we had plans about going out, but now you're saying that you can't go out just because you have a headache, is it really that bad? And you need to explain, I don't just have headaches. I can't see right now because of my migraine attack. I can't move without disabling symptoms. Explaining what the symptoms are that you're having, or explaining, yes, I have the neurologic disease of migraine. In fact, migraine is the 2nd most disabling disease worldwide based on the World Health Organization. And yes, it sucks and it's bad. And unfortunately, I wish I could go out, but right now I can't. Now, a lot of people will have comments about treatment options. So let's talk a little bit about that. People might say, can't you just take some Tylenol or Advil and be done with this headache that you're having? And again, your opportunity to explain what migraine is. Genetic neurologic disease, abnormal function. I have medications that I need to use to try to normalize that function that I use on a daily basis to manage the disease of migraine. And then I have medications that I use for attacks when I'm having one of those breakthrough attacks. Other people might say, oh, well, can't you just take your mind off of it? Oh my God, that one just kills me, right? For that one, I often will say, if someone was having an asthma attack, would you tell them to just take their mind off of it? No, you wouldn't. That sounds ridiculous. So why would you even say that to someone that's having a migraine attack? No, I can't just take my mind off of having abnormal function in my brain. I need to use something to normalize that function, whether it be non-pharmacologic techniques or even pharmacologic techniques. Now, here's another one. People will say, well, my uncle's sister's girlfriend's daughter cured her migraines with 100% pure snake oil extract. Maybe you should get that. That's going to cure your migraine. So, when individuals say things like that, or even if they come up with real medication options and say, oh, my uncle's girlfriend's sister's daughter took Topamax and that helped their migraines, it cured it. And in that situation, it's important for you can share with them if you'd like that migraine is a polygenetic disorder. It's a polygenetic neurologic disease. There's over 100 different genes that are associated with migraine vulnerability. So what that means is everyone's disease is a little bit different, and what works for one person may not work for another. And when people are giving you all of these different options, you can just gently redirect them and say, thanks for those suggestions, but I already have a doctor, a clinician, a headache specialist that I'm working with, and they know all my medical details, and it's best for me to get advice from them. Now, the other thing is when you're having a migraine attack, it's hard to be in a state in which you want to explain all those things, and I get it. At that point, you can just have your one snarky comment. You can add however much snarkiness you want, depending on how irritating the comment might be, and just say, I have a genetic neurologic disease, end of story, right? Or you just walk away, because sometimes if people are not receptive to understanding what migraine is, maybe these are individuals who are not your tribe, are not your people, and it's better to find a different community of caring people. The other thing too is taking the opportunity to reframe migraine, and this is when you're not having a migraine attack, right? It's easier to talk about things and have conversations when you're not having a migraine attack. And when you're not having a migraine attack, at that time, what you can explain is, number one, just share your story about migraine. Make migraine visible by sharing your story, validating and normalizing the migraine experience for other individuals who have migraine. Everyone knows someone who has migraine because it's so prevalent. And so if you talk about your symptoms, if you talk about your story, if you have the courage to do so, which is hard because, migraine is it makes you feel very vulnerable and can be intimidating to share your story. But the more that you do, the more educated you get, the more empowered you get, the more you'll be able to do those things. Now, words matter. And so I don't want you to let anything slide, whether you're talking amongst your migraine community, whether you're talking with your headache specialist, whether you're talking with your other doctors or clinicians, whether you're having a conversation with your loved ones. Don't let words slide. Use the word migraine, not migraines. Use the word migraine disease and use the word migraine attacks rather than using migraines with the letter S at the end. That will help emphasize that this is a disease and that in this disease, people may have episodic attacks. Use the word migraine attacks rather than using the word headache. Instead of using headache, you can even say head pain. But I'm really trying my best to move away from the word headache, even in my own conversations that I have with the patient. I'll talk about migraine attacks and I'll talk about their head pain, but moving away from that word headache. It just has such negative connotations to it, and there's just so many misconceptions. Making that differentiation between cause and trigger is really important. Talking about how this is a genetic neurologic disease with environmental risk factors. Another one, and this is one that the headache community, the headache specialists are really working on, is failing medications. It's like my huge pet peeve, right? Patients don't fail medications, yet that's the way that we've all been taught, that patients fail X, Y, and Z medications, now we have to try something else. Patients don't fail medications. Get the blame and guilt out of migraine disease. Reject that guilt. I didn't fail a medication. That medication was ineffective for me. right? And so even with your headache specialist, if they say, oh, yeah, you failed these 3 medications, correct them and let them know. By the way, Dr. Starling, I didn't fail those medications. It's not my fault. Those medications failed me, or those medications were simply ineffective for me or not well tolerated by me. What can they do, right? What can caregivers do? What can the public do? What can your coworkers do? If they ask you these questions, sometimes when you're having a migraine attack, you don't want to even have that conversation at that time, and that makes sense. But when you're not having a migraine attack, you can have conversations with your coworkers, with your loved ones, with your caregivers, with your friends and family about how they can participate in advocacy and participate in educational events. Because get this, for advocacy for migraine, we need not only people with migraine, but we need people who don't have migraine to advocate for us, because they're not having attacks on a frequent basis. And when we are having attacks and we can't participate in advocacy events because we don't have the energy and strength to do it on that day because we're having an attack, we need other people to step up and step in and take that place for us. So we need people with and without migraine to get in there. One of my favorite things that maybe some of you have heard me share is at a Miles for Migraine event. My kiddo, who at that time was 8, who has migraine, he was there at the advocacy event with his best friend who does not have migraine. And they were both there together, and they ran the 5K. And I had asked my son, why are you here? And he said, I'm here because I have migraine. And then I asked his best friend, well, why are you here? And he said, I'm here because my best friend has migraine. That's what we need. That's the world that we need to live in. And that's how we need to recruit individuals to become migraine warriors, whether they have migraine or not. So spread the word, share the right language. Words do matter. What can we do as individuals? We can talk about it. We can share our stories. We can make sure that we let nothing slide. It is time to be seen. It is time to be heard. It is time to make the invisible disease of migraine visible. So that is what we can all do. We want to empower, we want to educate, and we need to recruit as many migraine warriors as we can. So I know that some folks in American Migraine Foundation were helping me by sending me some questions that you guys had. Yeah, so some people will say other comebacks, right? So if you're not incapacitated, can it really be a migraine? And again, that's that spectrum of disease where some individuals, even the same individual, may have a migraine attack that's not disabling, but they may also have a migraine attack that is disabling. And so the spectrum of disease occurs within individuals and within the same individual as well. Yes, sometimes people will say, can't you just drink some water, go take a nap? So I have migraine myself, and when I had initially presented to a physician, I had aura, so actually I received a diagnosis pretty quickly. I was in college at that time, so the doctor said, oh, you're having migraine with aura, that's what's happening. And so it was like, okay, well, thanks. Now what do I do about it? And they said, oh, well, you should drop your major, because I was a double major. You should drop one of your majors. You should stop working. You should drink more water, stress out less, and get some massages. And as a college student, I was like, I want to have a double major. I have to work because I need money. I guess I'll try to drink some water. I can't get massages because that's expensive. And I guess I'll just take a bunch of ibuprofen. And unfortunately, that's what I did. And I ended up in medication overuse headache until I received better treatment later on in life. So when people say that, just let them know, this is abnormal function of my brain. This is a genetic neurologic disease. It's not that easy. I can't just use Tylenol or ibuprofen or drink some water or any of those kind of things. Let's see. People liked the asthma analogy. That's great. I love the distinction between cause and triggers. Some questions, not as related to what we're talking about, but very good questions. So, can wearing a mask be a trigger for migraine? So there is something called allodynia that some people have, some people with migraine have, and that's where things that are not painful become painful. And so when people have allodynia, putting their hair in a ponytail, wearing sunglasses or a baseball cap or a headband, those things can trigger pain, and that can include wearing a mask. However, right now in the setting of the pandemic, wearing a mask is of utmost importance for the public and for us as individuals to protect ourselves from getting infected with COVID and protect the public from getting infected with COVID. And so there are a variety of different masks that are available, or even those gaiters that are available. So I think it's important for people with migraine to find the option that works for them. Maybe not something that goes around their ears or the back of their head, but maybe a gaiter might be more helpful. So I think it's important to try to find those different options that can potentially work for you. But wearing a mask is of utmost importance at this time. Hashtag mask up for sure. I live in Arizona, and right now we're going through a terrible surge, and the hospitals are really going through a tough time, as are my colleagues in the front lines. So wearing a mask is doing our part and expressing compassion for everyone around us. Another question is about nerve damage and if that can be a trigger. Yes, there are times in which nerves can become irritated, and that can be a trigger. So more commonly, people will have irritation of the occipital nerve right here at the base of the skull, and that can become a trigger for migraine attacks. And so sometimes if people have nerve irritation in their neck or the base of their skull, that can be a trigger. And so there are many things that can be a trigger, and it's important to try to address those triggers, but at the same time, it's important to also treat the underlying disease, raise that threshold of the underlying disease so that we can manage migraine better. All right, let me see if anyone sent me any additional questions. All right, what I'll do, since I'm using my phone and it's sometimes hard with questions, is if you have any additional questions, I just put them in the comments, and I'll take a look at Facebook tonight after my patients, and I'll answer those questions for everyone. All right, thank you so much for being here. We had an excellent turnout of like 80 plus people. That's awesome. Remember, that I see you, I hear you, and we together will make the invisible disease of migraine visible so that we can have better treatment options for every single person who has migraine until we can manage the disease for every single person. Thank you so much for watching, everyone. Bye.